Right, welcome back. Thanks very much for staying with us here on SABC News. The 13th BRICS Health Ministers Meeting concluded today at the Durban ICC and was hosted under the theme Bridging the Gap on Sustainable Health on the Road to Universal Health Coverage 2023. The meeting concluded that BRICS member states should collaborate to strengthen health systems and to build back better. They also called to evaluate the midpoint of assessment of progress towards universal health coverage 2023. Sergey Glagolev, Deputy Minister of Health of the Russian Federation, now joins us via Zoom. Thank you very much, Deputy Minister, for joining us here on SABC News and certainly here in South Africa.
Thank you. Thank you. Good evening.
All right, let's start here. I mean, what similarities could one really point out to when it comes to, the health industry in South Africa and that of Russia? One would argue that there's not many commonalities, given that it seems that, Russia is miles ahead. So, when we have these discussions between our health system and yours, what is the common ground, really?
So actually, the common grounds are the standards of the countries of BRICS economy, the heavy involvement and heavy reliance on innovation, and certainly basic needs like ensuring sovereignty, ensuring equal distribution of vaccines, especially in times of crisis. So basically, during these and previous meetings, we found many common points where we can expect a significant progress in cooperation between our countries in the coming years.
We've obviously established the importance of BRICS as a partnership as a whole, but I wanted to focus specifically on health. What is the importance of partnerships? I mean, you've kind of touched on it here where you said you've seen some similarities, but let's talk about why it is important for all these BRIC nations to come together, but let's talk specifically from a health perspective where you see it.
Well, first of all, we all feel a need to push ahead the solutions created by the BRICS countries, tackling the most urgent tasks like preparedness for new pandemics, non-communicable diseases, and basically the countries now possess significant competences in these areas. I would name the experience of South Africa and Russia in developing new vaccines, in scaling up its production, finding appropriate transfer to new pathogens, basically shortening the time from detecting a new pathogen to developing an adequate and specific treatment for it. Along another point which I was glad to spot is nuclear medicine. So we conducted international workshop for BRICS countries dedicated to nuclear medicine last July, and basically what we see here in Durban hospitals, which we had a chance to visit thanks to Dr. Fowler, the Minister of Health. It was Albert Luthuli Clinic. We see a considerable professionalism in this area. So here, as well as in TB research and information exchange, there are many grounds for going ahead.
Yeah. Deputy Minister, let's talk about some of, the key sort of tangible or, important takeaways from the summit in building more resilient health system against future health emergencies. I mean, you touched briefly there on COVID-19, but, one can also argue that, we come with solutions really from experience. So we have to experience things before we're able to address them, which is rather unfortunate. But let's talk about those takeaways from that summit.
So if we focus on preparedness to newer pathogens, I would underline the progress we reached in shaping the integrated early warning system for preventing mass infectious diseases risks. So basically, it is focused on coordination of development of newer products, on detection of pathogen, and also on exchange of information on their genomes, their characteristics. And again, this research is heavily relied on the experience of the countries, but from pandemic we drew common patterns which can be easily applied. In particular, South Africa organized the transfer of mRNA vaccine technology, whereas a joint virtual now vaccine research center being created within BRICS countries. So basically, these competences allows me to expect that we would go ahead in a fast rate in foreseeable future.
Yeah, and I want to stay on the issue of COVID-19. I mean, it's obviously an opportunity to reflect on some of the lessons that were learned from the COVID-19 pandemic, and I would assume that, in the summit, you certainly did put some focus on COVID-19. I mean, one of the other issues that, was quite striking during the pandemic was the fact that some European countries, and I hope you take no offense, but of course some European countries did indeed do what some might have called vaccine hoarding. But then on the back of that, we found a situation where there wasn't, a lot of uptake of the vaccine in any case in many parts of Africa. And I know, we're talking specifically about South Africa and Russia in this point, but, the continent in general, there had been quite a lot of issues in terms of uptake of the vaccine in the first place. These are some of the challenges on both ends that were experienced. Did you have, wider conversations relating to that when you had this health summit?
So I think that most participants also underlined the unequal condition in terms of access to vaccines towards the global south. And I think the sole recipe to overcome this situation is to possess technical sovereignty competence. For example, Russia authorized the first anti-COVID-19 vaccine in August 2020. So it was a significant progress. And we easily scaled up the production, and the same occurred in many BRICS countries. So I think it's the sole solution which would protect us from future crises. I think the guarantee for smooth and adequate answer for future pandemic is possession of competences.
Yeah. What is quite important in South Africa, while we're talking about the issue of health, is that of traditional medicine and digital health and digital technology and the use of all of those coming into one. But also still, obviously, we're talking about westernized medicine. I understand that this was discussed quite extensively. How does this all help in the achievement of all the goals put together? I think that often traditional medicine is put on the back burner, and traditional healers are put on the back burner and sometimes not taken very seriously. But in the context of this continent and in South Africa, it is quite important. How much conversation was had around that?
So there was a deep discussion during the preparatory senior level meeting before the meeting of the ministers, and some aspects like traditional Chinese medicine, Ayurvedic medicine, for India colleagues was underlined. And we see now, for example, in the European healthcare practice and in terms of regulation of traditional products, there is a specific approach to it, guaranteeing their quality and enabling its use within the foreign cultural tradition. And I think the same approach can be adopted within the BRICS countries, in the other BRICS countries.
And what is Russia's position on sort of exchange programs? I mean, we've seen quite a few between South Africa and Chad in terms of exchanging ideas, advancing medicine between the two countries. What are there any plans to kind of do those sort of exchange programs?
As we are cooperating in a good pace, I think we shall create more channel of different level, of different depthness between our countries and between the entire framework of BRICS states. And here we strongly advocate the creation within the next year of joint BRIC medical journal, which will publish the peer-reviewed articles for arising from BRICS countries. And it will assure a non-discriminatory access of the entire world to our scientific achievements. Alongside, we strongly urge to consider creation of BRICS Medical Association, joining, harboring healthcare professionals from our countries. And alongside, there were discussions regarding formation of network, which would also deal with some aspects of providing information to end users, to patients, which is very important for, particularly for non-communicable disease and ensuring trust for vaccines. Alongside, I would say that Russia provides a free of charge trainings for postgraduate trainings for health professionals in many areas like surgery, obstetrics, pediatrics, and so on, and participants pay just for travel and accommodation. It is up to 1 month long, and it can be adjusted to the need of specific countries. And as many healthcare professionals from African countries had graduated from Russian medical schools, I think here we would be glad to see more visitors, more professionals in Russia from South Africa.
All right, Deputy Minister, great pleasure having you on the show. Thank you very much for giving us your time. Do enjoy the rest of your stay.
Thank you very much.
Enjoy the rest of your stay in South Africa. Thank you, sir. All right, that is Sergey Glagolev, who's the Deputy Minister of Health of the Russian Federation.